Hello, this is Dr. Robert Bates at the Concussion Center of Fitchburg and Leominster Chiropractic Spine and Injury Center. Today we're going to discuss whiplash and who you should see if you think that you or a loved one has had a whiplash or a neck injury. First of all, a bit about my education. I have been in practice for almost 35 years. I received a biology degree at Clark University, 4-year program. Then I went to Palmer College of Chiropractic, received a diplomate in chiropractic neurology. Following that, I did graduate magna cum laude from chiropractic school. I have taken 2 one-year fellowships in vestibular rehab and mild traumatic brain injury, have written several books and many articles. So I have been following the literature almost on a daily basis for decades. And this allows me to diagnose and treat whiplash using the most current neuroscience and treatment methods. First of all, what is whiplash? Whiplash is an acceleration-deceleration injury to the cervical spine. It can be quite variable depending on many different factors, whether you're aware you are going to be hit, what angle the impact is, how hard it is, also important factors such as the position of the headrest and your actual body style and the curve that is in your neck, how far away it is from the headrest. There are many, many factors. The mechanism of whiplash is that you have a very quick acceleration of the body, and then the neck starts to move and it stair steps up through the 7 cervical vertebrae, creating tearing as it goes through the neck until it reaches the upper neck, and then the neck inherently is bending backwards because the neck is going forward. This causes a S-curve or a reversed curve through the neck as this happens. The entire thing happens in about 400 milliseconds, which is less than a half a second. Many times people think something happened, and it is not really what happened, the way they moved in the vehicle. The best treatment for this type of injury is, first of all, to have a very thorough evaluation so that we can see what is hypomobile or fixated, what is hypermobile, which is, in my practice, something that I see misdiagnosed more than anything is an unstable segment where flexion extension views or stress views were not taken. Very important to do that. We also look at, of course, the neurological components. Is there nerve root irritation? And a very important aside to this is the fact that if the neck has been injured, then there is a good chance that there is mild concussion because there was acceleration of the head, whether it struck something or not, and about 30% of people in a mild car accident have concussion. So we need to evaluate for concussion because quite a few of the symptoms of concussion are very similar to the symptoms that you have with an upper cervical neck injury, with cervical disequilibrium and certain types of headache. So after a very thorough diagnosis is made, then you can begin doing the treatments to restore motion in the neck, to restore strength in the neck, endurance, and also the neurological input. So it takes a very thorough evaluation, which is not really performed in most places you go, especially the emergency room. They rule out fracture, that is their job. They rule out a potential bleed, and you are sent on your way. The research sadly shows that in a moderate whiplash, 100% of the time there will be arthritic change developing and a continual decline in function with more and more what we call sensory corruption. As the neck is moving abnormally, the receptors in the joints, muscles, tendons are sending abnormal information into the central nervous system. So the motor function becomes more and more dysfunctional, and unless you do things to keep as much normal function as possible by seeing a good chiropractor or someone that can mobilize fixations and give you appropriate exercises and movement things to do at home, then you will end up with an accelerated degeneration and just have more and more trouble. In fact, the research shows that in a moderate sprain strain where there is ligament damage, there is accelerated degenerative change 100% of the time. And this occurs because there are changes in function because of scar tissue, weak muscles, and reflexogenic spasm, which continually brings abnormal sensory input, or what we call sensory corruption, into the central nervous system, constantly changing motor function so that joints do not move very well and constantly stay irritated. This results in considerable degenerative change and increasing dysfunction. So what you need to do, like in any one of these physical problems, is you need to restore as much normal function as you can. And if you've just had a whiplash, you need to do things that limit the amount of degenerative change you're going to develop, like proper nutritionals, anti-inflammatories, proper exercise started at the right time, infrared laser, things that will give you the best outcome assessment. So if you have any questions, feel free to look at my website, Leominster Chiropractic Spine and Injury Center, or leominsterchiropractic.com, or the Concussion Center of Fitchburg. I am always available to answer your questions, and otherwise have yourself a great day.